Good morning, everyone. This is Deborah with Wilco Wellness, and I'd like to thank you for joining us today. We are sharing with you a very much needed and welcome shift in direct primary care. Impact Family Wellness is a standalone clinic which provides care with a more personal touch. The owner is Monica McKitterick, and she is an advanced practitioner registered nurse and the creator behind this nice, amazing new clinic. Hi, Monica. Can you tell us more about yourself?
Sure. Hi, Deborah. Thank you so much for having me on here today. Yes, I am a family nurse practitioner and have been for a little over 13 years now. I have a lot of experience in not only family practice, but also orthopedics. I did some veins for a while, some urgent care. But ultimately, I love to take care of a whole person, which is why I went back to primary care, because I really like to take care of all of you, not just part of you. Which is, why I do what I do, which we will delve into here shortly. But I am actually a native Ohioan. I moved to Texas about 2.5 years ago via New Mexico. I am happily married to my amazing husband, Clayton, and I have 2 sons, Dylan and Grayson, who are 20 and 6. So yeah, little age gap there, but they're super fun. But yeah, I'm super happy to be here today. Thank you for having me.
Thank you. I'm really glad to be talking to you today. Now, with every medical practitioner, there is a board certification. With the nursing, they have truly grown with what nurses have learned, what they have been able to practice, and what they are now practicing now, which I think speaks a world for that that ethics board, that standard of care. And this way, when patients go in, they know what to expect. On occasion, they may bump into somebody that is not quite so kind, and they can still go back to the board and they can read through that and then use those standards to find the person that cares for them the best. I know my mom would be so very proud of where the nursing Texas board has directed the nurses. As a nurse practitioner, what does that allow you to do?
Sure. And that's a really great question that a lot of people don't know. A lot of people are like, wait, you can do what my doctor does, but wait, I don't understand. So it's very, very normal for people not to understand this. So as a nurse practitioner, we are required to have a master's degree in nursing. Many people do have a doctorate degree in nursing. They're actually requiring that now for new nurse practitioners. I don't know if it's a complete requirement yet, but it's coming. And so we have advanced practice degrees in nursing, which then allows us to diagnose, prescribe, evaluate, refer, do basically everything that an MD or a DO could do. All states are a little different in terms of what nurse practitioners can do or can't do. My first 10 years of practice, I lived in full practice authority states, which meant that I could do all of the things and I didn't have to have a physician over me. The state of Texas does not allow that. They require that we have a collaborating physician. And so we have a collaborating physician who is on contract with our office and oversees, quote unquote, our practice here. And by that, it means she is required to review at least 1 chart a month. And we basically have to have it on file. The other restrictions that nurse practitioners have here in the state of Texas is that we cannot write for Schedule II drugs. And what that means is your narcotic medications and more specifically for us, ADHD medications. So our supervising physician has to sign those prescriptions for us. And I could delve into a really long story why I think that's not a great idea, but I don't make the rules. I just have to follow them. And so, we have to jump through some hoops in order to provide excellent care for our patients, but we're willing to do it. And it's worked out really well. We have somebody to call if we need to, but what's interesting is our collaborator is actually an emergency room physician, not a family practice provider. Therefore, she doesn't deal with a lot of the same things we do, right? She's used to saving lives. Like, she deals with people in car accidents and who are not breathing, not people who have thyroid disorders and ADHD. She never writes those in the ER, turns out, but she has to write them for us. So, you know, we jump through the hoops and we do what we have to, but ultimately as a nurse practitioner, it gives us the ability to treat patients just as a physician would. There's a lot of different schooling that goes with it. And depending on who you ask, I'm sure there's lots of different takes on this. But, you know, in our providers here have over 25 years of experience. And so, you know, we've been doing this for a while. So, you know, our patients love us. They love that we treat them like human beings. And that's really the biggest thing that we do is treat people like humans. It's amazing how that works.
Yeah, it is. It is. When people come in and they've got questions, it's nice to know that their practitioner knows their name. They actually know who they are. They know about their family. You actually can treat the whole family. So a person may come in and you can say hi to the kiddo and you know their kiddo, you know their background, you know some of the stuff that they're going through in their life. And I actually think that's a bonus, having a emergency medical care doctor over you, because a lot of times people might not come into a doctor's office until it's like, okay, I have no other choice. I have to go see somebody. And I know for my family, it's always, we don't want to go to an emergency place though, because we don't know what to expect. We don't know how long we're going to wait, how many people are there. And when my mom gets down here from Michigan, I can't wait to get her introduced and set up with your clinic. Especially, you know, minor fall that she has, and we need to know, is she okay, or do we need to admit her, you know? And you're going to be able to help with those questions, and she's going to feel better in knowing she knows you. And actually, I saw one of your videos and it said that there's even a direct line to you. So if there was a question, they're able to text you and say, hey, I got a question.
Absolutely. I mean, to be honest, my office number is a direct line to a nurse practitioner. We don't have receptionists. We don't have medical assistants. We don't have nurses. The only people on staff here are nurse practitioners. So if you pick up the phone and call my office right now, as long as one of us is not with a patient, we will pick up the phone and you will get the decision maker on the phone. But yes, all of our patients get direct access to text us. So probably 70% of the care that we provide patients is done via text message because it's convenient, right? If you have pink eye, I'm going to need to see you, snap a picture. I'm going to look at it and cringe and my eyes are going to water. And I'm going to say, yes, oh, that's terrible. Can you see? Is your vision okay? It is. All right. Well, let's try this medicine. I'm going to send this off to the pharmacy. There's just a lot of things that we can manage without actually laying hands on people, right? There's no reason for you to take off work, drive across town to my office for me to touch you when I don't have to, right? And we did that even before COVID, before telehealth was a thing. We always offered it because it's convenient, and because we don't have to jump through the hoops of insurance companies, we can do that as much as we want.
Right, right. And if somebody's at work and they just need to say, I need to get my blood levels done for my thyroid maintenance or whatever, your telehealth. Now, do you have it both via the phone, or do you also have the telehealth online where you could do a Zoom meeting, so to speak, with an individual?
Yes. So we have a telecommunication app called Spruce Health that allows us to text, call, or do video in a HIPAA compliant way so that it's secure. And yeah, we use it all day, every day.
Great, great. That's definitely helpful for busy people. Or trying to take off time from work and the boss is like, well, I really can't let you go right now. And that comes up. So you term Impact Family Wellness as a direct primary care. What is it that you see at Impact Family Wellness? Kind of give us an idea of what that means.
Sure. So we see patients of all ages from 2 days old to, I think our oldest patient is 96, maybe. And, you know, we see patients of all types, everything, honestly. We see a lot of patients who have either no insurance or have high deductible plans or health shares. We also take care of a lot of small businesses that either don't offer any healthcare to their employees, but wish that they could, but can't afford the $400 Blue Cross plan. But, you know, we treat patients of all types and all issues, from depression, anxiety, diabetes, high blood pressure, even the young, healthy person who just wants to stay that way. Unfortunately, a lot of people think you only go to the doctor when you're sick. Turns out we are a wellness people. Like it's much easier to keep you well than to fix you when you're broken. And so our job is to talk to you about your diet, your nutrition, your sleep, all of these things, your stress, your family. Like you said, we know all of our patients' names and who their family is. So we know who's causing that stress in their life and how do we fix it. But I'm here to tell you, if you don't sleep, life's going to get hard for you. And so many people don't realize that. And so, we see a lot of young, healthy people who want to stay that way and just need that person to call when, oh, hey, my kid has a rash. Should I be worried about this? Instead of going to the book of faces to ask random people for medical advice, they send their text message to us and then we answer it, in a medical fashion. So we have patients of all types, and we have patients with insurance, without insurance. We have Medicare patients, we have TRICARE patients, we have patients on VA medicals. Basically, it's people who want somebody who actually knows their name. They don't have to sit in a gross waiting room every time they come in. They come in, they get treated, and they go home, and they know that they can call us the next day if it's not better. And so, it's people who want convenience and care that they can actually use, which unfortunately in our current insurance-based medical system is just unknown. People are like, wait a second, this all sounds way too good to be true. How does this happen? It's like, well, we cut out the middleman. That's how it happens. So that was a long-winded answer to, we take care of everybody is the answer.
Right. And part of being healthy as an individual, a person needs to understand, according to their age, what are the different things that they need to do? If I'm just getting married, I want to be a mom, I have certain checkups I need to do. I have certain things that I need to keep an eye on if I think I'm going to go right into having kiddos versus I'm going to stay married but without children, but I'm athletic. Somebody going into their 40s, they have certain tests that need to be done to stay ahead of. Better to know what's coming than to find out, that you've got a serious ailment on the back end of it, and then medical care kicks in from there. So that's good that you set those plans up.
Yeah, absolutely.
Right.
And one thing that we changed this year is that we included annual physical labs with your membership. Granted, they were only about $38 to pay for them as a cash pay patient, but that gave our patients an excuse not to do them. And so now you're paying for it, right? You already paid me for it, so you might as well do them. And that gives us a better understanding of what's going on in your body, right? Like, I can look at you, I can listen to your heart, I can check your blood pressure, but that doesn't tell me what your cholesterol is, doesn't tell me if your thyroid's functioning. And these are really important things to have. And so by including those in their into their membership, it has really increased the number of people who get them done. So it's been great.
And the labs are very important. I am a no needle person. I do not like needles, right. But 3 times a year, since about, 12 or 13 years ago, when I found a clinician that really helped me in what was going on with my life at the time, said, I've got to take these labs. I'm sorry. I passed out getting my blood taken the first time, but the information that came from that made it so clear to me that every 5 to 6 months, we run the labs. And by running the labs, I'm actually able to use nutrition, vitamins, supplements, these types of things, and understand what's going on with my body. And, I feel great. I feel healthy. I feel good. I have friends asking me, well, what do you do? And I say, well, you got to get your blood taken so they can tell you what's going on, and you go from there. And once you have somebody, my person retired, and I thought, oh, what am I going to do? Because I'm used to going to the same person. I know who I'm going to talk to via Zoom, what's going to need to be done, and then, what's our next step in it. And I feel much safer. I feel much better knowing that, and that I have a part in it. So now, Impact Family Wellness, you have clients with insurance, but you've actually set up, again, a family care. There's a term that you use that it's a payment system that people join. What is that, and how does that work?
Sure. So our office is completely membership based. We are not insurance dependent whatsoever. We don't charge for office visits. We don't charge for procedures. We don't charge for those things. So Netflix for your doctor is probably the best way we can describe it, or affordable concierge, right? So All of our patients pay a monthly membership fee. It's $69 to $89 for adults, $39 for kids. We have a family plan. Family of 4 is $199 a month. And then that gives you unlimited access to the office. You can come in as many times as you need to. There's no copays when you come in. Like I said, you can call or text us anytime you need something, includes your prescription management. We also have a contract with a local lab. So if you need labs more than just once a year, just like yourself, we have about a 90% discounted rate. So you can get a full thyroid screen in our office for $9. And that's not just a TSH, it's a T4, T3, all the things, right? We also have a software that we can consult specialists free of charge for our members. So if somebody has weird symptoms, we're like, man, I don't know what this is. And we want to consult rheumatology, cardiology, endocrinology, all these places. There's 120 different specialists, including pediatric specialists. We can get these consults done within 12 hours. And we have saved our members so much money and especially time, right? When you can consult 3 specialists within one day, as opposed to waiting 6 weeks to go see an endocrinologist, it's pretty life-changing. It also teaches us a lot, which has been really great. It's been a lovely service to have. But basically our job is to take care of you. And so that's what we do. You pay your monthly fee and you can see us as many times as you need to. Our goal is to keep you as healthy as you can be, so that way you don't call me every day. The healthier you are, the less you're going to call me. So it behooves us to make you the best you that we can, but also allows us to spend time with people, right? Like all of our new patient appointments are an hour long, and all your follow-ups are at least 30 minutes, sometimes longer, depending on what we have to do. And so, we see 5 to 7 patients a day, maybe 10, where your average insurance-based provider has to see 30 plus a day. And this is why you get 3 minutes of their time, and you can only bring up 2 things today, and make sure that you don't talk about your allergies during your annual physical, or now it becomes a non-preventative appointment. So now you have to pay your copay, or you have to pay for it out of pocket if you have a high deductible plan. There's all the things, but yeah, by cutting out the insurance man, we don't have to deal with that. It's pretty great.
Right. My mother-in-law's thyroid panel that she gets done 3 times a year runs her with Medicare, with the backup supplement and all of that. She still pays $185. And that was one of the things I'm like, Mom, get online, check out your website, Impact Family Wellness website, listen to these videos. And once you get here, because she's moving from Michigan, we're going to go down and we're going to be visiting with Monica and the team and getting set up.
Yeah.
This again is very much needed, very welcome shift in care for people who want to be preventative. And that saves so much money. That's what's crazy, is it saves time, it saves money, it makes sense. And I didn't even know that if you brought up something during a medical visit, maybe that's why the doctors keep it to 2 minutes, because they have to kind of like, I didn't hear that, to keep everything drummed in the direction that it needs to go. And I work in a hospital and see people that say, well, I have an appointment to deal with this, but I can't get in for 5 months.
Oh my gosh. Yeah. The average wait time to see a primary care provider in this country is 29 days.
Wow.
People will die before they get in to see their provider, where we can get people in. I mean, I talked to a woman this morning on the phone who needed a primary care provider, and she has an appointment with us at 3:00 this afternoon. We can't always guarantee a new patient appointment same day, but we can always get you in within a matter of 2 to 3 days for sure. And it's just because we limit the number of patients that we take here. So keeps us open and available.
Open and available. You have 3 clinicians, I believe, 3 nurse practitioners that are there. Okay.
Yes, myself and Joanna and Katie.
And Katie. Okay. If somebody wanted to join Impact Family Wellness, they make a phone call, they set up their initial appointment. What do they do from there?
Well, the easiest way is to go on our website, and right on the front page, you'll see bright, shiny pictures of the 3 of us. And then you'll see a lovely sign that says register here. You click on that, you enter in your name, address, phone number, all of that, and it'll ask you for your payment information. Once that goes through, you get directed to the new patient scheduling page. So we do offer online scheduling, same day scheduling. Like I said, you will then pick your time and it will schedule your appointment. You'll get some forms emailed to you that you can fill out on your phone, and then you come on in. That new patient visit can be virtual or in person, whichever you prefer. And then we can get you on your road to wellness. So pretty simple. You can also call us and we can register you over the phone if that's easier, if you're not a tech savvy kind of person. But typically people just go on the website because it's super simple.
Okay. And then once they get all the information in, they receive, I guess, in an email what the payment schedule is, or how all of that works as far as the finances.
Yeah, so their membership will be processed on the same day every month. So if you register today, you will get charged on the 2nd of every month. It'll automatically process it through. We have software that does that for us, keeps those credit card numbers away from us. We don't have them. And yeah, it's pretty super simple, and we don't do contracts or enrollment fees either. Several offices like ours do. I don't like enrollment fees. I think it's dumb. Especially because you're the one doing the paperwork, not me. And then as far as contracts go, you're going to walk in this office and you're going to love us. So we don't need to put a contract in place. I also don't want to take care of people that don't find our service appropriate for them. Right. And so I'm not going to lock somebody into a 6-month contract and make them come in here and see us if they don't want to. That's just not the way we work. So there is a re-enrollment fee. It's really our only way to save our time, honestly, to keep people from using and abusing us. We haven't had to institute that very often. And then the only thing is there's a 30-day notice to cancel it, as with almost every membership-based anything, right? You can't even cancel your Netflix without a 30-day notice. So no real hoops to jump through. It's pretty simple.
Okay. All righty. And then it'll break down if it's a single mom with one child, family type of care thing. This is what the fee is. This is what it includes. And if there's any kind of extras, say like an x-ray, are you able to do x-ray there?
So we don't have imaging here. It's just too pricey for us to hold an x-ray machine here. But we do work with several different imaging centers in the area to get the best prices that we can. So we can typically get x-rays for about $50, cash pay MRIs for $350. CT scans are usually $150 to $250, depending on if we're using contrast. Ultrasounds around $200. But we have these great resources to get these patients the best cash pay prices we can. You can also run through your insurance, but I can't tell you how much that's going to cost you. Good luck with that. But most of them just use our cash pay prices because it's easy. Right.
And as an athlete myself, that's where I really see it. Me giving you that emergency call, so to speak, is I was out on my bike. I wiped out. I might have a problem. I'm up and walking, but can you guys get me set up so I can go in and get this looked out really quickly and then go from there?
Yeah, we have a lot of patients who will call us and be like, I think I might have broken something. And we're like, well, don't come see me because my x-ray eyes don't work yet. They're on back order apparently. But here's an x-ray order. Go to the x-ray place and then you come see me. And we can pull up the images from a lot of the local places so that we can actually look at them ourselves. And then determine the best way to go from there, right? Like there's no reason to go to urgent care and do an x-ray there if you have to go see an orthopedic surgeon, because they're going to repeat your x-rays, I promise it. And so, yeah, we try to make it easy. We like to do lots of procedures around here, so it's fun.
Right. Good. That's excellent. Thank you so very much. I can see your office is starting to buzz. And getting busy. So you are located in Cedar Park.
Yes. So our office is currently in a small office condo, but we're actually moving in about 6 weeks.
Wondered. I read a little information about that.
Yeah. So we're out of space here. We only have about 850 square feet here, and we're just kind of on top of each other. So we're moving to another location about a quarter mile north of where we are. So not far at all, but it's just under 2,000 square feet. So hopefully we'll be getting there around the holidays.
Okay. All right. And Impact Family Wellness is the name, and we can find you on your website, learn more about all of the practitioners there on the website. Very informational little videos that you guys provide. And
you get You can actually pick who takes care of you around here, unlike your insurance where they give you a list of, well, these are the providers you can see. That's all you get. Yeah, so we have tons of videos. It's impactfamilywellness.com. We are Impact Family Wellness on all of the social media worlds. We do a lot of Facebook Lives, so please feel free to follow us and you can see all of our info. We do one every week with some sort of tidbit of info for you. So yeah.
Yeah, you guys are great. I love the videos that I was watching as I was getting ready for this. I said that there's so much information there. So we've tried to put together just a little bit to help people understand who you are and what you do and what's available. And they can go to, like you said, your website, Facebook, get more information about you and get signed up.
Yeah, and if they have any questions, feel free to call or text us anytime.
Yeah, all right. Thank you, Monica. Truly appreciate it. I'm glad I got a chance to speak with you.
Thank you, Deborah. I appreciate your time.
All righty. Have a great afternoon.
You too.